Good morning. Tomorrow marks the start of World Breastfeeding Week and National Breastfeeding Month. The goal of both is to highlight the numerous benefits that breastfeeding can bring to both the health and welfare of babies as well as to nursing moms. Joining us live to talk more about this is Barb Donnelly. She is a lactation consultant at St. Peter's Hospital. Good morning, Barb.
Hey, Courtney. How are you?
Good, thank you. We hear so much about the benefits of breastfeeding. What makes it such a great choice for mom and for baby?
Oh boy, how much time do you have? Yeah, it really is sort of a win-win for moms and babies. For mothers, we often don't talk about the benefits to mothers. There are benefits to mom as far as reduced risk of cancers, postpartum depression, and even in the short term when babies latch right out of the gate, right after they're born, can reduce risk of a postpartum hemorrhage. For babies, of course, we know it's the best nutrition, the best mix of macronutrients, proteins, carbohydrates, and fats, chock full of antibodies, immune cells that help protect a baby from illness sort of in the short term and long term. So it's a living thing, and it evolves with babies' needs over time. It's pretty incredible.
And, unfortunately, for many women, there are barriers to breastfeeding. Mm-hmm. What are some of those barriers, and, why is it so important to empower parents?
Right. There are barriers, and, one of probably the biggest for a lot of moms, one of their biggest concerns is going back to work. That's the question I get most in my breastfeeding class is preparing for back to work, and how do you do that? How do you pump? What do you do? And, I often tell those moms, that's a big concern. Let's focus on establishing the breastfeeding relationship, because it is a relationship and an important one between a mom and a baby. And getting breastfeeding off to a good start, mom's milk supply off to a good start. And so barriers can sometimes be employers who don't support breastfeeding, maybe family members or friends who just aren't informed about the benefits and the importance of that relationship, who might, inadvertently make undermining comments or behaviors and not meaning to, almost always with good intentions. But so community support, the public being supportive, leaving a mom alone if she's breastfeeding, feeding her baby in public, and refraining from commenting, because it is her legal right to breastfeed anywhere she can legally be in a public space. So there are a lot of barriers for sure.
And, I think a lot has changed, especially in the past several years, that, with laws that, guarantee a woman a space to nurse. And it's, right. St. Peter's, we sponsor, baby cafes.
Yeah.
How important is it to have spaces like this for nursing moms?
Incredibly important. All of the research tells us that moms need support to be successful with their breastfeeding relationship with their baby. And a lot of that support does come from other moms who are breastfeeding and are dealing with different challenges along the way. So, right, the baby cafes are a wonderful place for moms to drop into to get that support from other mothers. But it is sort of staffed, or there are lactation consultants and counselors available there to answer more technical questions, but it really is mom-to-mom support, including our support group here at St. Peter's. So, and there's lots of online forums as well for mothers who maybe getting out of the house is a little challenging, but still need that mom-to-mom support. So it really is critical.
And that's something that we mentioned, new mothers, when they're in the hospital, they get support from lactation consultants, but right. Often when you leave the hospital, it can be really nerve-wracking, and yes. That's when you can encounter a lot of nursing problems.
Yeah.
Where can new moms go for support, continued support?
Right, and as you had mentioned, the baby cafes are a wonderful resource for that. Here at St. Peter's, we don't just toss moms out into the street and say good luck. We do provide ongoing support to our breastfeeding, pumping, partially breastfeeding moms. Anything that's going on with them that's related to breastfeeding, lactation, we're here to support them. So we do lots and lots of outpatient consults and calls where mothers can call us, and we get calls, a day after discharge. We get calls from moms a year after discharge with questions and concerns about breastfeeding. And as I said, we have a support group here, and we do encourage encourage moms to also reach out and get mom-to-mom support. La Leche League is another wonderful mom-to-mom support resource in the community. So there is a lot out there, and we do encourage moms to continually get that support because from their families, from their communities, because it will help them to meet whatever their breastfeeding goals are.
And, lastly, I guess if there happen to be any nursing moms watching and they're having struggles, what would you say to that struggling new nursing mom?
Yeah, and I'd say, I'm sorry you're struggling, and get help. Reach out for help. You can certainly call our lactation hotline, which is 518-525-1400 here at St. Peter's, and certainly dropping into one of the baby cafes, going online. 518 Breastfeeding Mamas is a Facebook group you can join. That's wonderful for our community. So there is a lot. And a lot of pediatricians are very supportive as well. So pick up the phone, make a call your best friend who was breastfeeding. Just reach out and get some help and support.
Great. Thank you so much, Barb Donnelly, for taking the time to talk with us today.
Okay, you're welcome, Courtney. Thank you.